Greetings from Quiz Committee of Indian Fertility Society. I welcome you all who are participating in this quiz. This is a national quiz which is conducted once every month. That is the last Friday after the journal club or before the journal club sometimes. So the winners of this quiz, first three winners will qualify for semi-finals, which is to be conducted at Fertivision. So they'll have a chance to go to Fertivision, right? And from there, we will have a final also in the Fertivision at Ahmedabad. Okay, so I have my co-host today, Dr. Rohani. She is Zonal Coordinator East for this quiz competitions. She will be joining. She will be quiz master for today's quiz. And today's quiz will be on male infertility. So before she joins, I give you, there's some instructions. Everybody please download Kahoot, and Kahoot will ask for a pin. When we start the quiz, there will be a pin displayed on the screen. You put that pin, and when you log in, just put your telephone number instead of putting your name. Put your telephone number, so we can identify everybody, the winners, right? That would be easier, and we have to contact them. Shivam, you can start. We can start. You just let them have a feel of Kahoot.
Okay, sir. So should I share the Kahoot pin?
Yeah, share the. Devika, just number, not your name. This is the pin on the screen 909156. You can put this pin, and then you will be into the game. Anybody can join till we lock this quiz. VID, please put your number. Devika, please put your number. Telephone number, mobile number. Rohani has joined. Welcome, Rohani.
Thank you, sir. Sorry for due to my internet connection, I was unable to join.
I was just doing your job for some time.
Thank you so much, sir. Thank you so much.
So you take over, now Rohani will take over and move on, right? Rohani, give time everybody to join. No?
Yes, sir. Yes. Yes, sir. So for this is hello everyone. Like the pin is displayed at the screen. So whoever wants to join, please put this pin in your Kahoot app. So we all have time till the last participant. We can wait, and after it is locked, no one else will be able to join.
Yes, we have 35 participants, maybe 2, 3, 30, and we should have minimum of 30. Just 16 have joined. So let everybody join, and then we can start, right?
Yes. Please join through your mobile number so that it will be easy for us to register. Please put your name as your mobile number.
One request to everybody, anybody who has already qualified through other quizzes, please, you can participate, but then you will not be considered. You have already qualified from other part, right? The previous quizzes. I can see Rakhi, Gurnam, and then we have
So anyone facing any problem in joining, you can put it in the chat box so that we can help you out.
everybody is invited to join and can participate. The only one criteria which is there is the age should be less than 45 years of age, right?
Yes. So any problem in joining, like just ensure your network is fine, and yeah, you can put it the pin and join through the Kahoot app.
There's a message from Dr. Anjana. She is unable to join.
Yeah.
Pooja, please put.
Yes,
please
Pooja.
put your mobile number. Generally, please put your mobile number. But Rohani, we have to still wait because there are 40 participants and only 23 have joined, right?
Yes, we can wait for more 5 minutes, sir, and then we can start it off.
Yes, yes. Number ending with 4129 is unable to join. Please sort it out. Shivam, please sort that out.
So 22 participants are there in the Kahoot quiz. So should we start?
No. Still, we have. In fact, the total participants in the Zoom are 42, right?
Correct. Right.
There will be more people who wanted to join, but then.
Okay, so we can wait around 5 minutes, right?
Yes, yes.
Yeah.
There are some messages in the chat box. Please sort them out.
Yes, so once quiz starts, you will be given options A, B, C, and D. So before you will be given 20 seconds for each questions, and after that it will be logged. So you have to answer it fast, and that is why you have to be on a good network so that the question, as soon as it reflects on the screen, you can answer it fast. And after that fixed time, it will be logged.
Dr. Rekha, you are not supposed to select options on the Kahoot screen. Kahoot screen on your mobile only, wherever you have joined through Kahoot, right? There you have to select the option. We have 42 participants, only 23 have joined. I don't know. Is somebody having difficulty? If they have, we can sort that out. Good, Dr. Rekha, all the best. Dr. Anjana, have you logged in? Is it possible now? Is your number visible? We have 23 participants.
So I think we can wait for more 2 minutes and we can start at 7:45.
Yes, yes. Because the next program is also there. Okay?
Yes, sir. Yes, yes, Dr. Dhruv, you have to put it in your phone number. Yeah.
Dr. Manishi, this is the pattern we have. The three winners from this national quiz will be, qualifying for semi-final, or you can go through your chapter quizzes also, right? That is another link who can qualify. The winners of chapter quizzes will have to go through the zonal quiz and then to the semi-final, right? These are the part. This is the final pattern which has been decided. 2 more minutes and then we start.
Yes. We'll start right at 7:45.
Yes, which is 43 and 2 more minutes, right? If you are second in national quiz, you are qualified. Manushi? If it is a chapter quiz, then you have to go through the zonal quiz and then to the semi-final. Dr. Palak, 20 questions.
So in next 1 minute, we'll be starting our quiz.
No, sure. I'm just answering the chat box questions, no?
Yes, sir. Yes. I think we have 26 participants.
Yes. Shivam, log the quiz and starts 45 already.
So let's start our quiz. Yes, and here is our first question. A cross section at the middle point of middle piece of human sperm will show centriole, mitochondria, 9+2 arrangement of microtubules, centriole and mitochondria, mitochondria 9+2 arrangement, and only 9+2 arrangement of mitochondria. The correct answer is centriole and mitochondria. Yes, that's the scoreboard. And the next question, how many sperm does a normal ejaculation contain? 100 to 150 million, 200 to 500 million, 600 to 800 million, and it's 4.1 billion. Correct. Most of them have given the correct answer. Yes. So the third question, which of the following features characterizes normal morphology of sperm head? Smooth, regular contour and round in shape. Acrosomal region should occupy 90% of the head area. One small vacuole in the post-acrosomal region and less than 2 small vacuoles in acrosomal area, occupying less than 1/5 of head area. Yes. The fourth is the correct answer. And The next question, which of the following is not included in the initial evaluation for differentiating non-obstructive agiospermia from obstructive agiospermia? Physical examination, serum FSH, semen volume, and urogenital imaging. Yes, the fourth is the correct answer. It's urogenital imaging. And our next question, in which of the following post-testicular causes of agiospermia, semen volume is normal? Retrograde ejaculation, ejaculatory duct obstruction, vasectomy, and congenital bilateral absence of vas deferens. Yes, that's the correct vasectomy. So the next question, which of the following is the most reliable prognostic factor for fertility outcomes after varicocele repair in non-obstructive agiospermia? It's the grade of varicocele, the serum FSH level, testicular volume, and testicular histology. The correct answer is testicular histology. So our scoreboard is: identify the procedure demonstrated in the picture. The next question, it's PESA, TESA, micro-TC, or varicocelectomy. Yes, this is a microscopic picture of seminiferous tubules. Yes, and our next question, the single most important determinant of technique of vasectomy reversal is surgeon skill, intraoperative quality of vessel fluid, duration since vasectomy, and length of testicular vessel remnant. The correct answer is intraoperative quality of the vessel fluid. Yeah, so the next question is, watery ejaculate is a known complication of which procedure? It's vasovasectomy, vasoepididymostomy, Tourette, and varicocelectomy. The answer is Tourette. Which of the following sperm selection method is able to select non-apoptotic spermatozoa? It's magnetic activated cell sorting, microfluidics, zeta potential method, or sperm birefringence. Yes, it's MAX, magnetic activated cell sorting. Yes, the next question is, identify the test method in the picture. It's MAX or HOS or sperm chromatin dispersion assay or tunnel assay. It's sperm chromatin dispersion assay. Yeah, and our next question, Sertoli cell only syndrome is associated with complete deletion of AZFA, AZFB, AZFC, or AZFD in the Y chromosome. Yes, it's AZFA. That's a score. And the next question is, the best available predictor of sperm function is sperm concentration, sperm motility, sperm morphology, or total motile sperm count. It's sperm morphology, strict criteria. The next question is, sperm concentration is number of sperm per mass unit volume, number of sperm per ml, number of sperm per unit volume of semen, or none of them. Yes, it's number of. So, and here's our next question. In agiospermia, fructose is absent in obstruction of rete testes and epididymis, ejaculatory duct obstruction, primary testicular failure, hypogonadotrophic hypogonadism. So the answer is ejaculatory duct obstruction. Scoreboard. Embryologically, the vast difference in body of the epididymis are derived from what developmental structure? Mullerian duct, Wolffian duct, urogenital ridge, gubernaculum testis. Wolffian duct is a gut. The next question. All are advantage of TISA except good yield in non-obstructive agiospermia, no microsurgical skill required, can be done under local anesthesia, can be used for obstructive and non-obstructive agiospermia. So A, the yield is poor in non-obstructive agiospermia. The next question is, the acrosome of sperm is formed from mitochondria of spermatid, Golgi complex of spermatid, nucleus of spermatid, or centrosome of spermatid. So it's Golgi complex of spermatid. The next question, which of the following is not included in the initial evaluation for differentiating non-obstructive from obstructive agiospermia? Physical examination, serum FSH for husband, semen volume, or karyotype of husband? Yes, karyotype of husband. The last question, testing for sperm DNA fragmentation is of clinical value in all of the following except unexplained infertility, recurrent implantation failure, history of mid-second trimester RPA, or repeated IUI failure. It's history of mid-second trimester RPL. It's usually the first trimester recurrent pregnancy loss. So congratulations to the winners of this quiz. Yes.
One also note down there and one second.
Yeah, so congratulations to all the winners of this quiz.
Thank you, Dr. Hani. Congratulations to everyone who has participated and special congratulations to the winners. I would just like them to identify themselves, put the cameras on and please identify yourself, 1, 2, and 3. So we can, we qualify for semi-finals directly, and please just unmute yourself and put your camera on and introduce yourself. First, second, and third. Hello, Dr. Nisha.
Hello, sir. How
So-
are you, sir? Good evening.
Sir, we are on time.
Hello, sir. Good evening.
Hello, Sarpan, yeah. So, first, second, third.
First, sir.
Good. You are from which place?
Sir, I am from Manipal, KMC Manipal,
What are you doing?
Saxiba Medical College. Sir,
What are you doing?
sir, I didn't understand.
What are you doing?
Sir, I am studying MPH in reproductive medicine.
Okay. Welcome. Congratulations. Second,
Good afternoon, sir.
good afternoon, Dr. Veena. Please.
Sir, I'm Dr. Veena. I'm doing first year MCH residency in Government Medical College, Thiruvananthapuram.
Okay, you are second, right?
Yes, sir, I'm second.
3, 1, 4.
Thank you, sir.
Good. Thank you. Congratulations.
Thanks.
And the third one? Who's the third?
Good evening, sir. Myself, Dr. Devika from Government Medical College, Thiruvananthapuram.
Government Medical College.
Thiruvananthapuram.
What are you doing?
I'm a second year MCH resident.
Both of you are from the same institute.
Yes, sir.
Good.
Okay, sir. Thank you.
Congratulations. So everybody is otherwise also welcome to join Fativision, which is being held at Ahmedabad in December. Right? Thank you from our quiz committee, and over to Nisha ma'am for the Young Turks journal.
Thank you, sir. Thank you. Thank you so much, sir. Very well conducted quiz, and I think we have all have learned a lot from this. Thank you, sir, for conducting so well. And thank you to Hani ma'am for.
Next quiz is on 25th of October, and
Yes.
that is on imaging infertility. Imaging infertility on 25th of October. So I request everybody who has missed out this time, please participate, and you can have a chance to, go to the next round. Thank you so much. Thank you.
Thank you. Thank you, sir.
Thank you, sir.
Thank you to
Thank
Hani
you.
ma'am. Thank you. Thank you. So guys, now we are starting. Welcome to the Young Turks. First of all, I would like to thank IFS, our president, Dr. Pankaj Talwar, for giving us this very unique platform where everybody can speak and express. Let me tell you one more thing, that all those who are going to present in the journal club, they are going to be part of a panel discussion or a debate in Fertivision. You will be on the stage, you will be the center of the whole this thing. There will be a one whole session with all the Young Turks only. Okay, so please be ready to participate. Please be ready to express your thoughts. Santosh, who's there? Shivam or Santosh?
I'm Shivam.
Shivam. Dr. Rupali, are you there? Have you joined?
No, ma'am. No, ma'am.
I just called
Yeah,
Dr.
yeah.
Rupali.
She just joined. She just
She
joined.
joined. Okay. Hi, Dr. Rupali.
Hi, ma'am.
Hi, Dr. Rupali. So, Dr.
Hi.
Rupali Basi, can you please start your presentation? Dr. Rupali, can you share the screen?
Sure.
Shivam, Dr. Kalpana has joined.
Not yet, ma'am.
Okay.
Not yet.
So this is today's topic, publication and research. Let me tell you, Dr. Rupali is a very active research person. She's doing a lot of work on her side, and we are lucky to have her here to guide us how to proceed with this. This is a very vast topic, and she will try to give us the insights into various parts of it. Dr. Kalpana is our expert. Dr. Rupali, can I have your CV, please?
Yes.
So she's a senior consultant, Department of Obstetric and Gynecology at Indraprasth Apollo Hospital. She's editor of IFS Journal. She she was joint editor of IFS in 2022 to 24. She's web editor also, and she's doing a lot of, she's an executive member. She's doing fellowship in ART, she's taking classes for those fellows. She has published in Journal of Fertility and Science Research. She's got the best executive member of IFS in 2018 and 20 and has done numerous publications. So welcome, Dr. Rupali. Stage is all yours. And I want you to, make it simplified. This complicated topic, please simplify this for us.
Thank you. So this is, I agree, this is a very, very dry topic, and I have actually tried to reduce the content and and slightly simplified it so that it can relate to the young researchers. And as we go further, we'll talk about more complex research and talk about publication per se. So I'm going to be taking a brief introduction. Then I'm going to be talking about why research is needed in the current era, types of researches, and then we go down to further what should be the research question, and then also about choosing a topic, choosing subjects and sample size. So these are the only things which I'm going to be talking about. The rest about discussion would carry out in the next further talks. The most important is research. Yes, you always need to do more research. To do research, even find out a question, you have to do research. So research is in the current scenario very, very, very important. When you talk of research, why do we need research? Of course, we need research in the current era when you talk of advancements in the different types of treatments, understanding conditions, understanding various female reproductive health, biological mechanisms, improving patient outcomes. So in the current era, nothing comes out without research. And research forms the basis of all patient management. It is not only your own growth as a treating clinician, but also for the growth of for the improvement in the treatment of patients. Public health insights, of course, it gives us an insight into formulation of policies, addressing health disparities, preventive care. Very, very, very important aspect of research is formulation of strategies, interventions, which will help us to look into the health care preventive aspect. Okay, now going over to the further important part. What are the types of research? As a clinician, as a young Turk, what are you expected to know? Now, there are various ways of classifying. You can classify it by the type of study. When you talk of type of study, it can be an experimental research, or it can be a clinical research or epidemiological. So experimental would mean that you're dealing more with lab component. Could be even mice related or experimental or hormonal testing related kind of research is what we call, where you're doing various different experiments and you're trying to find out the answers for certain things. Clinical research is one of the commonest research which is actually seen in our day-to-day practice, where we can actually utilize our clinical knowledge, our clinical data, our clinical experience to formulate it in the type of study which I will be talking of. I'll be giving a lot of examples in the further session. The third type of research based on the type of study is epidemiological research, where you actually take into consideration the incidence, the prevalence, and you are actually including larger areas of population, which are mainly relating to a population of a state, population of various, medical colleges, ethnicities together. Based on research methodology, you can simply divide it into a qualitative research or a quantitative research, where you can actually collect the data on that basis. Either it's a quantitative data where the data is based on numbers, whether it is number of patients, whether it's number of specific disease, or those descriptive data where you have specific categorization in the terms of numbers. Qualitative could be where the assessment or the categorization is not very objective, as in quantitative data. Type of data, yes, a research analysis or a research study could be a primary study or a secondary study. Now, what does that mean? A primary study would mean where you're taking into consideration raw data, where you are collecting the data from the patients, or you're doing your experiments, collecting the inferences and doing it. So secondary research is also now really upcoming, where you take somebody else's data. That is, you do a meta-analysis. You try to put in a review article where you are actually trying to review the findings of the research done by other people. So we will be briefly touching upon that as well, but not much today. And based on the methodology, it can be an interventional study or an observational study. Interventional studies obviously have certain concerns in terms of the ethics. Now, if it's simply an observational study also, please remember all these studies will have one column of ethical consent, ethical procedures. And interventional studies would be where you're doing a proper intervention or a newer intervention, and those kind of studies would require a more detailed ethical consent before we go into it, rather than an observational study where you are trying to observe as a silent person. So same, that is what leads on to clinical trials. Now, clinical trials is one of the biggest and commonest form of research, and indeed something which really carries a lot of weightage in the current era is a good structured clinical trial. When you talk in terms of research studies, testing new treatments, you can do it for new treatments or interventions, where you want to compare patients, evaluate, newer forms of treatment, newer forms of drugs, or even the traditional drugs which are currently being used, or any form of testing which is there. They can be again interventional or observational clinical trials. Are the two main types, where you can try either a newer form of treatment, newer form of surgical technique, newer form of procedures, drugs, etc., or observational study, where you take into consideration, say, outcomes affecting women undergoing IVF, or simple observation studies where the patient's already getting a adjuvant for poor ovarian response. You try to compare one adjuvant to another. Talking of epidemiological research, what categories the patients come in. Very important is cohort studies. Now, so when we finally after a research, you will be kind of publishing it towards the end, where it will either be a case control study or a cohort study. Now, both carry important value when you're just following a group over time to assess the risk factors of a disease. We call it a cohort study. It can again be retrospective or prospective, both ways. When we talk in terms of cohort studies, it is, suppose you just want to assess one factor. You want to assess, say, endometriosis and their effect on fertility outcomes. We call it a cohort study. You want to categorize, recently, which I came across, was categorization of adnexal masses, was cohort study, which was categorization where you took categorized the adnexal masses on laparoscopy. That was a cohort study where you're just taking into characteristic of one main thing. You don't have much of a control over there. Now, case control studies are also very, very important studies where you're comparing individuals with one condition versus another condition. I'm sorry. sorry, this, I do not know how did it come, sorry. So you have comparing individuals with a condition to those without a condition to identify a potential cause. So comparing women with unexplained infertility to those with known cause of other risk factors to identify. So this was one secondary form of a study where, you know, systematic reviews and meta-analysis have become now a big thing. Indeed, it is a very now carrying a lot of weightage. I think why? Because you are taking a comprehensive review of the existing studies. Now, these are actually a little more painstaking than they usually sound because you have to take into consideration multiple studies initially, define your criteria as to what your study question is, then pick up studies based on a specific topic. And topics could be very, very simple, like comparing success rates of IUI and IVF, comparing, you know, the role of adjuvant in POR, where one important meta-analysis or any or everything can be now studied as meta-analysis. They carry much more weightage because they are an analysis of original research articles. Now, those original research articles, which are already there, you will start comparing the number of patients which you are analyzing there, the total cohort which you have is much higher. There can be other categorized as other quality, you know, other studies also, but I did not think that was very important. Now, going over to the other aspect, the research question. How do you define a research question? So at the beginning stages of research, it is very, very important to pick up a good research question, because if the research question is not good, the whole enthusiasm of conducting the study goes down, the temperament goes down, and there are various factors. When I tried to formulate this PPT, when I looked up, there were so many factors, which I think were most of them points are very, very logical, because it's not just about your interest. It's not just about your interest, whereas although that comes first, that's one of the most important thing is that what your personal experiences, what your personal preferences is what you would like to, you know, study. But then there are various other factors. It is also dependent on what topic you can review, what topic you think you can do a research on. You also need to identify the gaps in the research or the emerging trends. Try to pick up the gaps and then talk about it, then study about it. If you feel that there is a lacunae in the field, or if you feel that, yes, you know, there is this aspect which still is controversial, that is the place where you can study that aspect according to what you prefer. If you're an IVF person, look into the IVF protocols, try to differentiate between IVF protocols, try to differentiate between the same adjuvants, you know, talking of the various adjuvants, because that's still a lacunae, because there is no one specific adjuvant which really improves the ovarian reserve in poor ovarian respondents. Attend conferences, seminars, see what is being discussed, because if you try to pick up a topic which is latest, it gives you more more encouragement, rather than picking up a topic which is, you know, obsolete, which, you know, people don't want to talk about and which has already been discussed. Consider the scope, the feasibility of the topic. Ensure that the topic is manageable within your time frame, within your resources. You don't have to shell out a lot of money. You have to consider the possibility, as in whether you have patients of that kind of a issue, whether you have that kind of patients with a footfall, with a decent amount of footfall in your own private clinic or wherever you are working. That will obviously help us to shape out our study question. Your academic and career goals, your skill development, whichever thing. If you're doing a post-graduation, pick up an area where you think you might want to do a further specialization in. Consult with your mentors and peers, because they would have an experience, they would have much more of an insight as to what topics would be feasible, what topics would be practical, what topics would be actually liked by people, and is the need of the hour. Then you formulate a good study question. So for a good study question, the basis is a good research question. That clarity should be there. There should be a clear cut question as to what you are trying to do. Many times we get research papers which are not very, very clear. They would just start with an observational study, but they do not know how, what they're actually comparing, and it gets very tough for them. So further is defining your test and control groups. Now, this is very, very important when you talk of defining your subjects. I think very, very, very important, because we do get studies, we do get papers when I'm like editing, we do get papers where this thing is not clearly defined. So here our aim is just to talk of paper publishing later on. But yes, initially we should have a good study to do that. A clear definition as to the inclusion criteria, exclusion criteria should be very, very clear at the beginning of the test. You cannot mix up the tests. You cannot mix up the two groups. The test group has to be receiving the treatment, the intervention, or the experimental condition. It should be exposed to the variable being studied, and it should be measurable. So apart from that, the control group will serve as a baseline. It will not receive the experimental treatment, may receive a placebo. And before you define these two groups, there will be one basic group, one baseline group, where you will talk of that all the patients of this, say, suppose you're talking of two agonist versus antagonist, simple agonist versus antagonist protocol. You would like to exclude patients of poor ovarian responders. So that beginning part can happen for both the groups. You might want to exclude patients of hypothyroidism. So those kind of things might be excluded in both the groups. And then you define your treatment and your control group. So apart from that, sometimes indeed, if you are actually randomizing in your study, in your clinical trial, a good way will be that you give the control group a placebo, because that could be blinded. That way the patients are, the control group is receiving a placebo, where you could be blinding or not be blinding also. Those things are later on. So random assignment and blinding ideally ensures that both groups are comparable and free from selection bias. Blinding can be either single, where only the test group is blinded, or it could be double, where the patients who are the test or the control group, as well as the clinician, whoever is giving them the treatment, is blinded. So in double blinded studies, that is the participants, that is the test as well as the control group, or the researchers, neither of them are aware of what is being assigned. It is in the form of a sealed envelope or a secret code, which is kept by a third person. Now, one area which I really wanted to talk was sample size calculation. So that's the last part of my talk, because I get a lot of articles where there is the way sample size is calculated is very, very wrongly written. Now, when you think of a study, you have to think of some basic terms, some basic things, as in the incidence or magnitude of the disease, the incidence or the occurrence of that phenomena. That has to be like a poor ovarian reserve. How frequent is poor ovarian reserve? How frequent is polycystic ovarian syndrome patients? How frequently do you encounter? Then you will look into something called as alpha error. There is an alpha which will tell us the significance level of the expected parameter. The power of the study, which is usually between 80 to 90%. 80% is what is usually taken. 90% means a very high-powered study. Standard deviation would mean that how much, especially for continuous outcomes, how much it can vary from the midline. Suppose you're saying that the disease or the parameter varies from, say, 1 to 5, then you have to kind of look into that. The proportions for binary outcome, and finally the attrition rate. for every study, there has to be a specific attrition rate, or an expected dropout rate, which would be seen in these patients. Now, when you're talking of a continuous outcome, the sample size is usually calculated by this formula, where Z alpha, Z beta, where parameters used are Z alpha is Z score for desired confidence levels. Typically, 1.964 is usually what we see in our studies, and Z score for desired power is 0.84 for 80%. Standard deviation is represented by sigma, and effect size is seen by delta. So the same thing. Now this formula is there, but the whole thing is that how do you calculate it? There are various online softwares which are very easily available, which will, you just have to add on these few parameters. You don't even have to add on much about about parameters like Z alpha and Z beta, but yes, you have to tell about the incidence of the disease, the power of the study, the standard deviation, and these online calculators are excellent tools when you talk in terms of sample size calculation. Or the other way is that you go to a statistician. They will just, talk to them on the phone, and they will help you out, and they will tell you what the status is. All right. So these are the things which are there. I will be talking about various other aspects of publication, not only publication, first research, then we'll talk about publication probably in the next talk. We should be able to finish. I think that's about it. And we have a fertility science research journal where we assist at least the IFS, fellows and young people to publish. This is for the fertilization, where we are conducting a basic research methodology dedicated workshop. Apart from that, these are the various programs which are being run by IFS, and they're the centers and programs, very, very detailed programs with a beautiful, barcode scanner for QR code scanner for membership, where you can just become a member in 7 minutes.
Just Dr. Rupali, we'll need to just clarify this a little bit. Can you please go back to the last slide?
Yeah.
Yeah. This is, no, yes, this one. So see, all these programs are there. They are patient empowerment program, intelligence empowerment program, young empowerment program, counselor empowerment program, nurses empowerment program, and even self-empowerment program. So this is you just need to scan this barcode, and within 2 minutes, you will become member of IFS. There are mentoring sessions as this one, as Dr. Rupali has beautifully taken this session, making such a, exhausting topic so simplified. So all these mentoring sessions would be there. These are the benefits of becoming IFS member. So if any one of you can ask more questions about it. Please go ahead.
All right. So I think this is about the fertilization, where the upcoming fertilization, which is like a huge national, with a lot of national and international faculty, which is a huge academic extravaganza, I would say, on the 6th, 7th, and 8th at Gujarat. And these are the steps again to become a member. Very, very simple. 2 minutes to 4 minutes, you have the certificate. Thank you.
So as I understand, this is only half of your talk, Dr. Rupali, right?
Yes.
You have
actually, it's a little dry topic, so I thought it's better we discuss it in bits and pieces.
No, that's really thoughtful of you. You've really simplified it. So if anybody has any questions, please, you can go ahead and ask. I think Dr. Kalpana ma'am is there. Ma'am, have you joined? Dr. Kalpana?
No, ma'am.
Acha, ma'am was about to join. But I think Dr. Rupali can answer the questions. If anybody has any questions, if any doubt you have, if you want to ask about any publication or research, please go ahead. Please unmute everyone. Shivam?
Ma'am, they can unmute themselves.
Yeah, okay. So, any questions, please? I think, Dr. Rupali, you have explained it so beautifully that everybody has understood. Okay. Thank you so much, Dr. Rupali. And I would
Thank
like once again to thank IFS for giving us this opportunity to share our knowledge and encourage our young Turks to, yeah, Dr. Kalpana ma'am has joined. Ma'am, Dr. Rupali gave a brilliant talk about research methodology. We have our young Turks here. I welcome you for this journal club. I understand you had some emergency, you couldn't join earlier. Ma'am, is there, guys, can you please, you can go ahead and ask any questions. Ma'am, if you have any message, please tell us.
First of all, I would like to apologize for joining so late. And I just joined, so I have missed the talk event. But I welcome any questions if any junior has. So talk was basically on research methodology. So I'll just request our juniors to do one thing, which is very important, that whenever they start working after ethical approval, what they do, they go on doing, and most of the time the data is not collected properly. And when at the end they want to prepare the master sheet, then at that time, many times falsification or fabrication happens. So I request all the young Turks to make an Excel sheet in the beginning itself and do weekly updates of all the findings and everything. So this will be of great help, and whatever data comes, it will be most authentic and true data. So this is my request to all the juniors, and if they have any query
And we have
pertaining to it.
so much of data in our countries. We have so much of experience. I think so many centers doing so many cycles. But the problem is that this we are not able to still publish. We are not able to put ourselves on the international front because of
Yes.
lack of publications. So we want our juniors to come and publish, and that is the whole idea behind this mentoring sessions. Ma'am, if there is any template or anything, if you can provide, which will help everybody to, sort of what all should be taken care of. Dr. Rupali explained it very beautifully for at least collecting the data. Maybe next time we can discuss that also. Okay. Thank you, ma'am. There is a message. Let me just see if somebody wants to. Yeah, so that's actually applauding. Very nice initiative. Thank you. Thank you, everyone. Thank you, Kalpana ma'am, for
Thank you.
joining. Thank you, Dr. Rupali, for
I'm
giving.
so sorry for being late.
No, it's okay, ma'am. We understand. Dr. Rupali, thank you so much. You covered all the aspects of it very beautifully, and we are looking forward to have another good session from you with the good mentoring from Dr. Kalpana ma'am also. Thank you, guys. Thank you so much. And that's it from my
Thank
side.
you, Dr. Nishar,
Good
for
night.
the
Good night.
opportunity. Real thanks to IFS as well for giving me this chance to talk.
Good night. Good night.
Okay, good night. Thank you, ma'am.